Hey friends, Dr. Corey Babb here. One of the most common types of questions I get are ones that concern hormone replacement therapy. And I've done some videos in the past on things like thyroid supplementation, or if you've watched any of my Facebook Live videos, I talk about things like estrogen and progesterone and testosterone as well. But today I wanted to really focus on testosterone supplementation for women and how it can be a very beneficial medication or therapy for those that are deficient in it. So join me this morning with Looking Beyond the Labs when we go in and delve into testosterone. Of testosterone, let's look at it from a biochemical standpoint. So testosterone is what's called an androgen, and androgens are a type of steroid-based sex hormone. And what I mean by that is that they're derived from cholesterol. Testosterone specifically is made up of 19 carbon atoms with some ring structures on them, and is actually synthesized from some precursor hormones like dihydroepiandrosterone and things like that. When we talk about biologically active testosterone, we're usually looking at either testosterone or its kind of more highly metabolic form, dihydrotestosterone. And both of those kind of play into the way that we supplement things or how people are dealing with symptoms or things like that. So that's kind of the basic biochemistry of why this hormone is so important. Now, interestingly enough, there's been this cultural idea that women don't need testosterone or even that they don't produce it. And that can't be further from the truth. On a daily basis, a premenopausal woman actually produces roughly 10 times more testosterone than she does, say, estradiol, which is a form of estrogen. Men obviously do produce more testosterone than women, but women actually are more sensitive to the testosterone that they produce. So it's kind of this interesting interplay. In premenopausal females, the ovaries are the main source of testosterone in the body, and that shifts to the adrenal glands once menopause is hit. So there are lots of different conditions, therefore, that can cause problems with formation of testosterone if it targets one of those two glands, depending on where a woman is in her reproductive life. Now, you might say, well, that's all great and good, thanks for the biochemistry lesson, but how does this really affect me? Well, testosterone deficiency, when it presents clinically, manifests as some very vague symptoms. But when you put them all together, you get a good picture about it. So obviously things like fatigue, weight gain, decreased metabolism, lowered sex drive, inability to gain muscle with exercise. Those are some kind of hallmark low testosterone symptoms. And if you look on commercials or on the radio or things like that, you'll hear these men's clinics talking about, do you have any of these symptoms? And they usually include erectile dysfunction in there as well. And if you do, well, then you could benefit from testosterone supplementation. And that's true, but there are a lot of things that contribute to those symptoms as well. So you can't just hang your hat on, if you have these things, you automatically have a testosterone deficiency. Now, aside from those previous symptoms, testosterone is actually very important for a woman's vaginal and vestibular health as well. The vestibule of the vagina, which you've heard me talk about before, but it's the part anatomically in between the vulva and kind of the labia on the outside and the actual vaginal canal itself, is incredibly rich in androgen receptors, so testosterone, dihydrotestosterone, things like that. And from an embryologic standpoint, it's actually very similar to the part of the male urethra that comes out of the prostate. So medications, therefore, that affect testosterone either production or the body's ability to absorb that testosterone can lead to what's called a hormonal vestibulitis, which I talked a little bit about in my sexual pain video that I posted earlier this week. And so, one of the most common offenders for that we see, especially in premenopausal women, are birth control pills. A lot of birth control pills, if they're taken orally, kind of activate this hormone called sex hormone binding globulin out of your liver. And what that does is it goes around and picks up what's called unbound or free testosterone. Well, that's the stuff that your body's actually using. And so if it's picked up and unavailable for use, then tissues that are very testosterone dependent will start to get really aggravated or irritated, and that manifests as a vestibulitis if those vestibular tissues are affected. Now, what about an excess amount of testosterone? How does that present? Well, obviously, we kind of have this cultural idea that, well, if you have high testosterone, you're going to have, a beard, or you're going to have a really deep voice, or you're going to be really like ripped or things like that. And in women, that can happen, especially in super physiologic levels of testosterone. That's called virilization, when you actually see a more change from a feminine phenotype or kind of structure into something more masculine. But prior to that, in women, what we see, if they have high levels of circulating androgens, so testosterone, the dihydrotestosterone 2, is that yes, they may have increased facial hair, and yes, they may have a little bit of an increase in the Adam's apple, usually not too much. But things like oily skin, acne, especially on the body, so chest acne or back acne. If they have thinning of their hair, that's actually another sign of high testosterone. And then increased body hair, so kind of on the chest, on the nipples, and if the pubic hair kind of spreads outside of the kind of what's called mons pubis, or the kind of the top portion of the pubic bone there, it actually spreads onto the inner thigh. That's more of a male quote-unquote pattern hair distribution. So those are some symptoms, of really high testosterone amounts. And the most common endocrinopathy, or disease related to the endocrine system that we see that causes that, is a condition called polycystic ovarian syndrome. And I'm going to be talking about that at another video here coming up really soon as well. So stay tuned for that. So let's say you show up to the office and you want to get your testosterone levels checked because you think you may have, one of these symptoms. So something to keep in mind is that testosterone is considered a diurnal hormone, meaning that it has peaks and valleys depending on where it is during the day. So you want to get it tested first thing in the morning, preferably before 2 p.m. if you can, because there are certain things like exercise, activity, high power stances like standing arms akimbo and stuff like that that can affect your endogenous levels of testosterone. So that's the first thing when you want to get it checked. The second is that we want to actually look and see what the lab values or the lab ranges are. I've had patients come in who said, well, my provider told me my testosterone was normal because it fell within that lab established normal range. Well, to put that in perspective, I had a lab one time say that their free testosterone range was between 0 and 4.5. Well, 0 is never normal. You don't want 0 really of any hormone. And so to say that, it's in the normal range when it's like a 0.001, well, that's not really true. So that's another thing we have to look at. So when we're drawing testosterone, there are a couple of other labs that we typically get with it. So we're going to break testosterone down into both its free and total state. And those are kind of used differently depending on what we're doing as far as treatment. The other hormone that we attach with it a lot of times is that sex hormone binding globulin, like I previously mentioned. And using a total testosterone and a sex hormone binding globulin, we can actually create a ratio to develop our biologically available testosterone that's present in the bloodstream. Now, I know that you may have heard before that some people recommend getting salivary testing for hormone levels. Like I said in a previous video, all I can say about that is that the specialty societies that, I trust, like ISWISH, ACOG, things like that, they don't recommend that salivary testing. It just hasn't had the same amount of FDA approval to confirm that it's as accurate. So that's kind of your mileage may vary. Okay, so now we've gotten our labs, and let's say it comes back, something in the low range. And I typically use, when I'm looking at free testosterone, if a lady has a value less than 2 nanograms per deciliter, I'm really looking for symptoms. And if she has them, I may consider putting her on testosterone supplementation. So how do we do that? What's the best route for that? Well, when we talk about medication, there's something to keep in mind, especially with testosterone, and it's that there's not an FDA-approved form for women. So what that means is that if I want to give you testosterone, I either have to compound it, like send a prescription to a compounding pharmacy and have them make it into a cream or an injectable or some form like that, or I have to take an FDA-approved version for men and change it to a woman's biologic level, which is roughly 1/10 of the amount that we should normally give a man. The other thing to think about too is the actual route of administration. Testosterone is very poorly absorbed through the gut. So taking like a testosterone pill or something like that doesn't really do as well as, putting it in a cream or an injectable. The other thing is, if you are using some sort of topical preparation, you want to consider placing it on areas of thin skin, so it can get more easily absorbed. So put it on kind of your inner thigh, kind of on your your wrist here, things like that. There's typically warnings when those are with those topical administrations that until it fully dries, it can be transferred to other people. So if you do put it, on your wrist, you don't want to then go around and be rubbing your wrist on a bunch of babies or something like that, because you could potentially be giving them an extra boost of testosterone. So in our office, we typically either will compound a cream or a gel, or I'll do an injectable, which is, like I said, roughly 1/10 the male dose. And then injectable is given, once every 2 weeks to every 4 weeks, kind of depending on values and things like that. Now, you may have seen some ads either on the internet or whatever for some of the testosterone pellets. Now, the pellets are not FDA approved, and they're kind of listed actually more as a nutritional supplement, which is how they kind of skirt under that FDA radar. And what happens with the pellets is that if they're inserted, you get this super physiologic level. Like, we'll see ladies whose total testosterone is in the 300 to 400s, which is great for a guy. And they, universally feel amazing. Their sex drive is really great. They're feeling awesome. And then it crashes and they feel like crap. And lo and behold, that's the time for another pellet. So it's one of those things where you really have to look at the safety of it. There's not really been a whole lot of long-term documentation about it. The other thing is that, like I said, it pretty much is we send you really high and then we drop you really low. So a lot of those ladies have very substantial side effects when they're on that low end of things. And that's the reason I personally don't do pellet therapy. I just don't like that huge shift between really high levels and really low levels. Now, what about if your testosterone levels are too high? Let's say you have polycystic ovarian syndrome, or you have androgenic alopecia, which means that it's hair loss secondary to really high dihydrotestosterone because that DHT is toxic to the hair follicles. There are some testosterone blocking therapies that we can use. One of the most kind of cheapest ones, obviously we mentioned birth control pills, so that's something there. We also will sometimes use a medication called aldactone or spironolactone. It actually was originally a blood pressure medication, but it does block testosterone formation. And then for some women, especially if they have like actual virilization from, say, like a tumor or something like that, we'll actually put them on a medication called Lupron, which was originally developed for prostate cancer, and it shuts down the production of testosterone from the brain. It also does induce kind of a menopausal state too, so it's not without its own side effects, but it definitely, if you are a woman that's having that virilization, that's something to consider. So now we're on therapy. How often should it get checked? What's kind of the long-term risks? What are the benefits? Kind of things like that. Well, there's not a ton of long-term data, especially for testosterone supplementation in women. And for that reason, especially when we're starting a patient on supplementation, we're checking blood levels, fairly consistently, whether that's every month, every other month, every 3 months, kind of depending on where they are in their treatment cycle. Once they get to a level once they get to where their symptoms are feeling good and we have a physiologic kind of stable level, that's where we try and keep that testosterone with supplementation. The flip side of that is if it gets too high, we always kind of back off, or if it's too low, we can always increase too. Other things to kind of look at, especially if you have a woman who's been on testosterone supplementation for many years, you want to look at cholesterol levels, because remember, it is a cholesterol-based hormone, so it can cause your cholesterol to go up. You also want to be checking their blood count, because it can actually cause concentration of blood, and in really high amounts can cause a condition called plethora, where you actually get, really reddy cheeks and things like that because your hematocrit is high. There are a couple of other things in the long term that we look at with it. But overall, it's very well tolerated. And like I said, as long as we're keeping things at that kind of a physiologic level to where a woman's feeling good, we don't have to worry about too many of those side effects. Well, friends, I hope you enjoyed this delve into testosterone on today's Looking Beyond the Labs. As always, if you have questions or concerns, please feel free to comment below. Please, if you enjoyed this video, like my channel and hit that subscribe button and ring that little bell so you get notified when I put out a new video. Otherwise, I'm Dr. Corey Babb, and I hope you have a great and wonderful day.